Hello, I'm Michelle Fox. Welcome to Port Huron Hospital's Today's Health program. Today we're going to be talking about shoulder injuries and common causes of shoulder pain. Joining me is board-certified orthopedic surgeon Dr. Timothy Lucas. Dr. Lucas, welcome back to the program.
Thank you for having me.
Let's start with the anatomy of the shoulder. What parts are we talking about?
The shoulder is a ball and socket joint, much like the hip, except the ball and the socket are shallower. So it's comprised of the ball and the socket and the cartilage surfaces. In addition, the shoulder has very strong muscles that hold it in place, called the rotator cuff, and that's comprised of 4 tendons. We have a model right here. So there's 1 tendon in the front, 1 in the back, and then 2 on the top. In addition, in the shoulder, the biceps tendon actually attaches inside the socket and then exits and comes down and comprises your bicep.
What are the most common causes of shoulder pain?
The most common cause that I see is rotator cuff injuries and tendinitis. Rotator cuff tendinitis can come from several different things, mostly prolonged overhead use and impingement, where it can actually catch on the front surface of the shoulder, or the acromion. In addition, you can develop tears from either sudden injuries or from long-standing impingement.
What are some of the most common symptoms of a shoulder disorder?
The most common symptoms that patients complain of are pain with certain overhead movements where they feel their shoulder actually catching. They can feel a popping sensation. They can feel their arm kind of drop or feel like it's lost strength. In addition, a lot of people will complain of night symptoms, night pain, pain that actually wakes them up at night where they can't get comfortable, they can't lie on that side.
How do you diagnose a shoulder disorder?
The key to diagnosing, there are several keys to diagnosing shoulder problems, trying to differentiate what it's coming from. For rotator cuff injuries and tendinitis, we start with a good history. We want to find out from the patient, did they have an injury? When are they having pain? Where is their pain at? Is it radiating down their arm? Is it more in the shoulder itself? In addition, whether they're having pain with certain activities, and if they've tried anything that's helped, any medications that have helped, icing, those type of things. After that, then we'll go to the physical examination. I'll be able to test the patient's range of motion, both actively, passively, check the strength of the different rotator cuff muscles. In addition, looking for any atrophy, any other possible referred causes of pain. After the physical examination, I'll typically do an x-ray as well, and that helps define the bony anatomy. People that have certain bony anatomies can be more prone to having impingement or rotator cuff problems, and we'll pick that up on this special x-ray views. If I'm suspicious of a rotator cuff tear or tendinitis, I may consider obtaining an MRI at some point that will help define that anatomy, whether there's a tear there, whether there's a lot of inflammation or fluid around the rotator cuff as well.
This is great information. We need to take a break. We'll continue in a moment.